Morning, everyone.
Morning.
The meeting will come to order. The clerk will note the roll. There is a quorum. We have the minutes of the March 19th meeting in front of us. Representative Carlson moves approval of those minutes. Any corrections, additions, changes? Seeing none, all in favor of approving the minutes of March 19th, say aye. Aye. Opposed? Motion prevails. The minutes are approved. Okay. Members, today we've got several things on the agenda. We're going to review the governor's budget first. If we get through that, we'll take up some, though probably not all of the bills, because a few of the people aren't able to be here this morning. I'm anticipating that we'll come back after session and do any remaining bills that are needed, as well as the overview of Minnesota housing with Commissioner Tingerthal. So with that, I'll ask Commissioner Frans and Margaret Kelly to come forward.
Mr. Chairman?
Yeah, Representative Carlson.
Well, we have a good number of members here, quorum present. I do have a question, and that's...
Yes, sir.
Will there be a budget resolution for this biennium, being that we're now going to have the budget overview? You mentioned that we are going to have a supplemental bill, and as you may recall, it's optional the second year of the biennium as to whether there's a budget resolution or not. We've generally had one, but...
I'm anticipating, Representative Carlson, that there will be a budget resolution, yes. I don't know that we will act on it this week, though. Obviously, there's not a lot of time left this week. My best guess at the moment would be that we'd act on it right when we got back from the Easter Passover break.
Well, that was going to be my follow-up question. If you were going to have one, then when? But very good. Thank you.
You're welcome. Well, Commissioner Frans, Director Kelly, welcome back to the Committee on Ways and Means.
Thank you. Good morning.
I appreciate you coming forward to go through the governor's budget. One thing I do want to particularly highlight and ask that you go to, which is on the tax side, I know, but I know that you're with MMB and handle all the money, is I have been struggling to try to see how the governor's tax proposal is revenue neutral, as was mentioned or said when it was brought forward. And so I guess at some point during your presentation, if you could go through and show how it's revenue neutral, I'd appreciate that. But go forward through your presentation however you have it planned. I just want to make sure that we get to that question at some point.
Well, thank you, Mr. Chair, and thank you, members, for the opportunity for Margaret Kelly, Budget Director, and I to be here this morning. What I would do is this budget has a number of different proposals, and I'm not going to try to go through all of them because there are some minor ones, but I'll try to go through some of the major ones and then give a little indication about how the numbers, how the math works, and then open it up for questions. One of the things that we tried to do in working with Budget Director Kelly, and I just want to give a shout out to the hardworking nonpartisan staff at MMB for the work that they do time and time again, and working with the committee staff here to coordinate and communicate all this information. What we really tried to do was put together a budget proposal that is fair and balanced in terms of making sure that we continue to have budget surpluses. As you know, we've really been working hard over the last number of years to have a balanced budget and to make sure that we live within our means. And one of the things that we've tried to do is to make sure that, in addition to building up our rainy day funds to almost $2 billion now, we also recently, about a year and a half ago, were upgraded back to AAA by one of our credit rating agencies, in part because of the fact we've been able to balance the budget and create a rainy day fund in the event of an economic downturn, but also to make sure that we have budget surpluses year after year. So the main points that I want to make is that the investments today, or the investments that the governor made in his budget proposal, really scan a lot of different areas. And so what I'd like to do is, I think you have a handout that shows a one-page presentation of the, yes, it shows the fiscal year 18-19, and you see $329 million at the top. So let's go through the math and as we walk through this. So the February forecast projected a modest surplus of $329 million for 2018-2019, and an additional $251 million for 2020-2021. So right now, this morning, I'd like to focus on 18 and 19 and the $329 million surplus. So the first item you see on that is safe and secure schools. Governor Dayton has invested $47 million in total, but of that, $21 million for safe and secure schools to improve student and school security. These funds would allow local school districts to make additional safety upgrades to school facilities, be able to hire additional staff resources, and provide school-based grants for mental health services to students who need additional support. The governor also invests an additional $26 million in education for a number of programs that have been really proven to help children succeed, including voluntary pre-K, School Readiness Plus, and special education funding, along with child care assistance funding. Those items make up the $47 million. If you look at the next item, the senior and vulnerable adult protections, the governor would propose investing $12 million in 18 and 19 to go toward protecting seniors and vulnerable adults. We all understand that Minnesota seniors deserve access to safe, high-quality care at every facility in the state. And they need to know, and their families need to know, that if something goes wrong, the state will investigate in a timely manner. The governor's budget supports the recommendations of an independent work group convened by AARP Minnesota. Strengthening our licensing, advocacy, investigation, and communication systems will help ensure seniors receive the care that they need and deserve. The next,
Commissioner, when you're going back to the safe schools and education, you know, I'm looking at this management and budget supplemental detail. When I look to education, I only come up with like $35 million or $36 million of general fund money for the biennium, but I see 47 on here. Can I ask where the other 11 is?
Yes, Mr. Chair. So if you go through the spreadsheets, what we have here is the $21 million for the schools. You have the schools.
Yeah. It's in human services.
Oh, some of it is in human services, Mr. Chair. The safe in schools, there's $5 million of that is in the human services
So
department.
that's the mental health grants?
Right.
Okay.
Right.
And what about the other 6?
I'll get back to him.
We've got the chart here, Mr. Chair. I'll look that up and get right back to you.
All right. Okay, go ahead then.
In the opioid treatment area, the governor proposes $13 million from the general fund in 2018-2019 to respond to the opioid crisis facing our state. This investment would support high-impact strategies like ensuring first responders have access to naloxone to treat and prevent opioid abuse. It would also focus communities on focus that are really disproportionately hit by the opioid addiction. Now, the governor's proposal includes a creation of a new opioid stewardship program, which will help play a vital part in our efforts to fight this crisis in every community throughout Minnesota by funding these activities into the future. In the bonding bill area.
Excuse me, I've got a question from Representative Detmer. And if people have questions as Commissioner Frans is going through his presentation, please feel free to ask them. Representative Detmer.
Yeah, Mr. Speaker, it's on the large sheet that's handed out. Should we wait with that, or?
It's on which sheet? Oh, no, you can, if you've got some detail about what he was bringing up, go ahead.
Thank you, Mr. Chair. And if you look on the 2018-2019 general fund budget, I'm looking at the state government and veterans. Actually, the governor is reducing that budget by 11. I'm assuming 11. Is that 11,248,000?
Mr. Chair.
Commissioner,
Yes.
what page are you on, Representative Detmer?
Let's look at the numbers on there. Page
Page
4.
four?
Page 4, Mr. Chair.
Okay.
If you go down, actual estimated spending, I'm just looking at the line with the state government and veterans, and I guess my next question would be, Mr. Chair, is where is that 11.248 million taken? Is it from state gov, or is it from veterans, or combination?
Okay, Commissioner?
Mr. Chair, Representative, part of what happens in that particular area is we are canceling some of the monies that were originally appropriated for the premium relief security program. You may recall last year in early session, we passed a 25% premium reduction program for insurance companies, and we're not going to need all of that money, so we would cancel about $58 million of that money instead of going back to the reserve, bring it to the general fund. And it comes into that budget area, and so that's why there's a net reduction of $11 million is because there's $58 million being transferred, or that's being canceled and put into that budget area.
And, Mr.
Representative
Chair, so how does that affect veterans?
Commissioner, how does that
Mr.
affect
Chair.
veterans?
Representative, yeah, we'll have no effect on any veterans programs. This is the net, that's the net number in that billed area.
You know, Commissioner, as long as you're on that subject of the reserve, so you're talking, you know, as I look at these two healthcare programs we set up, you know, the names are so similar, they are a little bit confusing, but the program, which was the 25% rebate to people of their health insurance premiums that we passed in January of 2017. Now, I know there's extra money anticipated to be available from that program because it wasn't all used. Is the total amount $58 million, or is it more than that?
Mr. Chair, it's actually more than that. So in the November forecast, we canceled some more money at that time. You may recall the total was about $327 million. And of that, there was a part that was for reimbursement of particular items for health and for continuing continuity of care. The other $12 million was just for the reducing premiums by 25%. So in November, we discovered that although we had been able to help over 100,000 Minnesotans reducing their premiums, something like 110,000, that we weren't going to need all that money. And so the November forecast canceled about $99 million that was then, based on the budget agreement from last year, was directed to Health and Human Services. Now, since then, we have another $58 million that we would propose canceling at this time, because if we don't cancel it now, it will go into the reserve on June 30 at the end of the fiscal year. There's still a little bit more money in there. We just don't know yet. All the premiums haven't been reimbursed yet, so we have to wait a little bit longer to get the final total on that, but we're confident that there's an additional $58 million that we could cancel before June 30.
Okay, so I guess what I'm getting at then is, I mean, if we did nothing, there'd be an extra $58 million that went into the budget reserve, but you're proposing to change the law so that that money doesn't go into the reserve.
Mr. Chair, correct.
Okay. All right, just wanted to be clear on that. All right, thank you, Commissioner. Please proceed.
Mr. Chair, we'd like to go back to safe schools and education, the $47 million, and Budget Director Kelly can add up the $47 million for you.
Director Kelly.
Mr. Chair, the 47 is a combination of safe schools proposal at MDE and DHS and the education funding in the Department of Education for early education and early education at the Department of Human Services.
Okay, maybe I'm missing something somewhere, because I guess what I'm still trying to struggle with is when I look at page, I guess it would be 9 of this handout, I see the general fund expenditures for education in 2019 are just under $36 million. Is that 5 million, and that those mental health grants are 5 million, if I remember right, that are in HHS. So I guess what I'm trying to find out is where's the other 6 million? Or what is the other 6 million?
Mr. Chair, the other 6 million is education funding, not specific to safe schools.
Well, but again, Director Kelly, if I look at page 9, the total of all education funding, including safe schools as well as other funding, is $35,918,000. So I guess I'm rounding that to 36 million, and then I'm saying, okay, there's another 5 million of these mental health grants, which are carried in DHS, but I guess we're sort of saying are part of the Safe School Initiative. So that's another 5, so that gets us up to 41. What is the other 6 million?
Mr. Chair, it has to do with early education spending and human services, and I can identify those for you in a second. I'll look up my list.
All right, thank you.
All right, Mr. Chair, I think we're ready for the bonding bill.
Okay,
The governor's capital budget that we released on January 16th recommended a $1.5 billion capital bonding projects around the state. Now this budget includes $37 million. Part of that is for the interest cost of the bonding bill, and the other part is for additional cash projects in the governor's bonding bill itself. So the governor's bonding bill is a combination of the interest payments in this biennium for the bonding bill, plus some additional cash projects for some of the projects that required cash in that bonding bill. The goal really for the governor's bonding bill was to provide an opportunity to take care of the assets that we have. This is really what we would call a no-frills bonding bill proposal, in the sense of taking care of assets, making sure that we maintain the buildings that we have. There's a large allocation, over $500 million of the $1.5 billion was for the University of Minnesota and Minnesota State Universities, and the remaining amount of that really was scattered around the state with our state assets to make sure that we take care of water quality, affordable housing. So we really wanted to make sure that we made these investments. We believe we have the debt capacity to make a $1.5 billion bonding bill, and that we have the funds to pay for the interest cost. So this would include the additional interest cost above and beyond an $800 million bonding bill.
Representative Erdahl.
Thank you, Mr. Chair, and Commissioner Frans. I commend the governor for being for his emphasis on infrastructure and on asset preservation. I think that's very important. We may quibble a little bit on the size of the investment this time, but I think that in many areas the governor is on the right track. How much cash is in the bill? I guess that's my question.
Commissioner.
Mr. Chair, Representative, the extra interest cost is $11 million, so there's $26 million in cash in the bonding bill.
And Commissioner, the 26 million of cash, now that 11 million of interest, is that the additional interest beyond the $800 million bill that's in the forecast plus the housing bonds, or is the housing bond interest part of the 26 million?
Mr. Chair, the $11 million is just for the general obligation, or is it also for the housing? It's for both, I'm sorry. It's for both the additional housing and for the general obligation from $800 million to $1.5 billion, including the housing portion as well.
Okay. Representative Hausman.
Thank you, Mr. Chair. I note that in the on 9 of 34 and 10 of 34 under Employment and Economic Development, there are 3 construction projects: Family Partnership, Family Tree Clinic, Tubman, normally would be in a bonding bill. Help me understand why they're here.
Commissioner.
Mr. Chair and Representative, well, on a number of occasions, projects like this have been in the bonding bill, and the governor felt that these were strong local proposals. As you know, there's over $800 million in local proposal projects that are out there, and there's over $3 billion in requests in general. So the governor, in trying to keep the bonding bill to $1.5 billion, really focus on state assets. But there were a couple of local projects, like the ones you mentioned, that the governor felt deserved special attention, and that's why he included them in the bonding bill.
I'm sorry, Mr. Chair, that they're not in the, because it looks like they're going to be in a spending bill instead.
Oh, I'm sorry, Mr. Chair, Representative, the ones you mentioned are in a separate spending bill. The particular items you mentioned, those are in a special spending bill, outside of the bonding bill. They have been in the bonding bill in the past on occasion.
And Mr. Chair, just one more, if I could, would we find more of those through the supplemental spending, other than those 3?
Mr. Chair?
Commissioner.
No, just those 3, Representative.
Okay, I've got Representative Carlson, Vogel, Anderson, and Garofalo. Representative Carlson.
Yeah, Mr. Chairman, Commissioner, I asked a question the other day about what it would cost between the 800 million in the forecast and the 1.5, and I think the ballpark number was 20 million, and now today it says 11 million. Is there a difference there, or is that just a refined number, or is it the staging of the issuing of the bonds? What's the difference? Because that's about 9 million.
Commissioner.
Mr. Chair, Representative, before the forecast, that was the original, 19 million was the original cost. After the forecast, we've reduced it to $11 million. So that's the revised forecasted amount for a $1.5 billion additional money for interest for the bonding bill.
Okay, very good, thank you.
I guess to that point, Commissioner, I mean, that seems like a pretty big change. I mean, interest rates, if anything, seem to be going up rather than down. Why was there such a big change?
Mr. Chair, a number of factors go into that. I mean, part of it is the bonds that we have sold recently and refinanced just last October or September. We sold about $800 million in bonds, and some of that was refinancing. And you may recall that some of the interest rates we got were like 1.9% and sometimes under 3. So there were a lot of money got sold at a very good rate for us. And so restructuring some of those prior bonds, about $400 million helps. But also, part of it goes into staging. How quickly do we think we need to sell the next batch this summer to maintain the cash that we need to for these projects? But, you know, the other thing, too, is that, you know, by doing it this way and by the rates we've been getting, the rates have been coming up, you're right, but they haven't come up enough to make that, to catch up for what we've been able to save.
All right, thank you. Representative Vogel.
Thank you, Mr. Chair. Commissioner, looking on page 21, and I realize it's 11 million in 19, but in 2 short years out in 21, we're talking 52 million, almost 53 million, which is almost 5 times the amount of general fund needed to service those bonds. You had talked about our credit rating, and is there any concern at all that as we take on this additional indebtedness, well beyond the $11 million, that it's going to start to impact our credit rating, especially if we end up in slower times?
Commissioner.
Mr. Chair, Representative, well, I think that's a great question. It's always a concern, to be honest. I mean, I think we, and any state, they're going to have the credit rating agencies looking over their shoulder in terms of what is their debt compared to how the state is doing with the total overall personal income. And as you know, Representative, the basis we use for affordability really is the total personal income in the state of Minnesota every year, which is approaching $300 billion a year. So they look at that, and what they try to do is they try to measure Minnesota versus that capacity to pay, but they use that to compare all the different states. That's one of the reasons back around 2008 or so when the guidelines got changed. One of the reasons was that we saw that the rating agencies wanted a way to be able to compare apples to apples to other states. So that's one of the ways they do it, is looking at that kind of ratio. But you're right, there is a concern because you never want to take on more debt than you can. So I think part of the way that we have looked at this is that we've been rated with low to moderate debt burden by most of the rating agencies. So there are a couple things going on. There's the main 2 components of that are the amounts that add up to the general obligation debt and the unfunded pension liability. So you take those 2 in combination, and those are really the issues that they're looking at. So you're right. We want to be careful as we project these numbers in the future, because obviously the next biennium you have 2 years rather than 1, and you're selling more bonds. It's going to cost more. So that's an issue we really want to monitor. But we think this is affordable. But on the other side of that, and one of the items I'm going to talk about in just a minute, if not the next item, is pension reform. And to the extent we can get this pension bill passed that the Pension Commission has been working on really hard this last several months, we think that will help reduce our unfunded liability by almost $3 billion over the long term. So if we can manage, we have to manage both of those debt items, the debt obligation and the unfunded liability of the pensions, together very carefully. So part of our recommendation here does, in fact, assume that we will make progress on a pension reform bill that provides more sustainability to our pension fund. So it's that combination that we think going forward makes sense. But your question is well taken.
Representative Vogel.
Well, just one quick follow-up. I know we have a lot. I guess, yeah, what I would appreciate is looking at both this and recognizing, too, that pension bill is also backloaded. And I think what we have to look at is the significant amount of cash that's going to be needed out of the general fund, both as we go forward with this and then combining it with the pension, so we can get some idea of the impact on that. Thank you.
Commissioner.
Mr. Chairman, let me follow up with that. I think, one of the pension reform proposal that is currently before the Senate and on the floor today, I believe, is $27 million for funding for this year, and it's $114 million for the next biennium. And it phases in over a 6-year period. But one of the great things about the pension bill that I will say is that it's really been a situation of shared sacrifice. Literally everyone affected by that bill is contributing. The COLAs are being reduced, the employee contribution is being increased, and the employer contribution is being increased. I think one of the things that the governor certainly believes in, and I think the Pension Commission has struggled with, is making sure that there's a shared sacrifice approach to this, because if you do it that way, it can be much more affordable. If you just have the employer cover everything, then it's going to be really difficult to afford any kind of pension sustainability package. We know, for example, that the the rating agencies literally look over our pensions every month. They're watching, they're monitoring what we're doing, and we know that failure to do some pension reform could have some negative effects on us going forward from a rating agency point of view. I mean, obviously, we have to do what we think is right for Minnesota. But I think that one of the things that we believe that with the reduction in the discount rate of 7.5% for all the plans under the pension bill is another step forward to reforming and making sure that we don't have pension funds making assumptions that are just not sustainable. So it's that combination of factors that I think are really important in talking about the pension bill. But you're right, they have to fit within the budget, both this budget year, 1 year, and for the 2-year budget year next year.
You know, Commissioner, on this subject that Representative Vogel raised, I seem to recall that it takes about 5 years for us after we pass a bonding bill to actually issue all the bonds. By the time we have, pre-design, design, the construction, different phases and so forth. So I guess, it's fair to say as I look at, 2021 has about $53 million more in debt service under the governor's proposal than what is in the forecast. I mean, do you have any idea what those numbers would be in 2022 and 2023, by which time all 5 years would be out? I mean, clearly it'd be at least $53 million a year, but I would guess they're somewhat more than that.
Well, Mr. Chair, I mean, certainly this November, in the November forecast, this special forecast this November because it's one time that we look at 3 biennia together. So we'll look at the 18-19 biennium and the 7 or 8 months, 6, 7 months left, the 2021 biennium and the 22-23 biennium. So at that point, for sure, we will have some projections, talk not just about the obviously the debt service and pensions, but the entire budget. We'll be trying to look forward for that budget year. So that's when we're really going to have to, have a better view of what's going to happen in the future.
So you don't have any numbers for 2022 and 23?
Mr. Chair, we don't have them with us. We'll see if what we project. I think we might have some that go out that far, but it's not in context of a forecast. But we'll get those numbers for you.
Okay, and yeah, if we, thank you. And we probably ask for those same numbers for the pension bill, although we may have those already. But all right, let me go back to the list, Representative Anderson.
Thank you, Mr. Chair. Commissioner, I'm just looking at the cybersecurity piece that you have as part of this bill. And if I'm reading it correctly, you've got about $19.6 million in fiscal year 19, and then you have tails of about 5.9 million. Can you talk to me about why the change in the number? I know in 2017, the governor had proposed that the cybersecurity cost for the state was actually $153 million. So have we done some cybersecurity work within this last year, or why such a drastic change of a request of $153 million from the governor for cybersecurity to now about $25 million?
Commissioner.
Mr. Chair, Representative, the number you're talking about last year was the complete package for both cybersecurity and all the different IT infrastructure around the agencies. So some of those were funded in this last bill. So I can get those numbers and kind of walk through the difference. But the only proposal here is just for the cybersecurity, which was not done in the last budget. So this is where Commissioner Clyburn has focused on, let's just take one step and, because the cybersecurity, which is really a lot of this is the data center, securing the data center a little bit, a lot more. So she wanted to focus this session on cybersecurity and then talk about, in the future, but we can talk about next year what we should do long-term for IT issues in Minnesota. But obviously, she's focused on the Min-Lars issue and trying to resolve that, and then wanted the cybersecurity to be part of the package only for this year.
Representative Anderson.
Thank you, Mr. Chair. Yes, Commissioner, I think those numbers would be helpful because even if you were to parse out that $153 million, you're still looking at a $74 million investment for cybersecurity, which is data center specific and so forth. That doesn't include some of the other items. So I think it would be helpful for me to know what exactly that you have spent out of that $74 million that you had as an ask and if the numbers kind of add up. But also I want to know, Commissioner, if you have the confidence in Minute to handle this task of cybersecurity, given all of the things that they have under their belt right now, dealing with the Min-Lars mess. Now we're learning about the Mets mess, everything that has been taking place on this. Can you tell me if this is something that you think that they're going to have the capabilities to do, given all the other kind of fires they're putting out at this point?
Commissioner?
Mr. Chair, Representative, sure. Part of that money that you mentioned earlier, just to get back to that point, some of that, was not funded. So some of it was funded, some of it was not funded, and then some of it was cybersecurity. But I'll put together a spreadsheet for you on that. With respect to Minute, I think, Commissioner Clyburn is, for those of you who have worked with her and met with her, is a talented woman, and I think she's got a good handle on what needs to be done. I mean, it's frustrating, and I'm the first one to say that, I'm frustrated too over the delays and some of the issues that have come up. And I think what she's trying to focus on is, first of all, fixing what needs to be fixed right now, obviously, and then also figuring out, okay, how does she position that agency going forward? And I think part of her task is, and she's looking at this, is to figure out what can they do to really promote both the cybersecurity aspect and securing the data centers, but also trying to secure those other IT centers around the state where we have people interfacing with our system. So I do have a lot of confidence in Commissioner Clyburn, and I think she will put together a team, put together some proposals that will really help Minute figure out how best to serve the state. And that's something that, obviously we're getting a lot of input from you folks here in the legislature that's helpful. And but anyway, I'm optimistic that she can do that.
Representative Garofalo. Representative Carlson.
Yeah, Mr. Chairman, you didn't reference when you were on education the $20 million for higher education. The University of Minnesota made a request, and I'm trying to recall exactly what it was, but I thought it was close to the $20 million, and then they would not be able, or then they would not raise tuition if they got that amount. But the $20 million here says for both Minnesota State and the U of M. So what are we accomplishing there with the $20 million when we look at both systems?
Commissioner, I know we haven't quite gotten to that in your presentation yet, but
If it's
go ahead.
coming up, that
Yep.
would be fine.
Yeah,
I
no,
thought
that's
he was
fine.
done with education when we jumped to cyber, but.
Oh, okay. Yeah. Well, we've been jumping around, and that's okay.
Yeah.
Please go ahead.
Well, it's Monday morning in the Ways and Means Committee. What could be better, right? No, so there's $30 million in total for higher education, $10 million for the University of Minnesota, $10 million for Minnesota State, and an additional $10 million for Minnesota State to work on their new infrastructure, their IT infrastructure. One of the things that they requested, and they got some funding for in the last session, was to begin initialing this new IT infrastructure that they need there desperately. And so they started last year, but this is an additional request by the governor to support that specific project at Minnesota State. So it's $30 million in total for higher education here. Of course, over $500 million in the bonding bill dedicated to higher education.
Yeah,
Representative
Mr. Chairman, I was interested in the comments by the president of the University of Minnesota about not being required due to a lack of funding, I guess would be the way to put it, the ability not to raise tuition. And what I was trying to find out then is this, the 20 million, the other 10 would be a different question, but the 20 million, does that provide enough for the two systems so that they don't have to raise tuition?
Commissioner.
Mr. Chair, yes.
Okay, that's what I wanted to find out. Thank you.
Okay. Representative Torkelson.
Thank you, Mr. Chair. Mr. Frans, I just want to backtrack a little bit. You mentioned earlier about a $55 or $57 million cancellation of insurance funds. What are the potential uses of those funds? What are the potential uses of those funds?
Commissioner.
Mr. Chair, Representative, well, so if we did nothing, as the Chair mentioned earlier, if we did nothing, then on June 30, those would cancel. Whatever funds are left in that premium relief fund for the 25% premium relief, those would all cancel and go to the reserve. We propose canceling that or changing it so that we instead direct that money to the general fund for use as part of the governor's budget. But obviously, we can decide to do other things with that money as well.
So they could be used,
Representative
thank you, Mr. Chair. They could be used, Mr. Frans, they could be used to fund any need in state government, like Minlars, for instance?
Commissioner.
Mr. Chair, Representative, yes.
Thank you.
Representative Nornis.
Mr. Chair, I was going to address the university question that Carlson had, and that's been covered, so.
Oh, okay. Commissioner, going back to our sheet here, because I don't see any other questions at the moment. You were on the bonding bill, and when we left it, you talked about there being $26 million in general fund projects that were being funded. Now, are those in addition to things that are shown like here in the governor's budget? For example, I look on page 12 underneath the health department, I see capital laboratory equipment, $2,327,000. Now, that's the sort of thing that has often been carried in the bonding bill. Is that part of that 26 million, or is the 26 million other stuff that's not listed?
Mr. Chair, no, that particular request has been put in a funding bill request, so they're not part of the $26 million, the health labs.
There's a,
Director
Mr. Chair,
Kelly?
Mr. Chair, there's a bonding piece, and then there's a cash piece, and the cash piece is included in the cash amount. There's also a bonding piece and a cash piece to the capital security proposal, and that's included in the cash amount.
So I'm sorry, Director Kelly, you're saying there's a bonding piece and a cash piece for the laboratory equipment in the public health lab?
Mr. Chair, I'm sorry, I misunderstood. There's a bonding piece and a cash piece for improving the lab itself.
Okay.
And then there's cash for laboratory equipment, both for the health department and the agriculture department.
Okay, so the cash,
In the bond.
you say there's a bonding piece and a cash piece. Is that cash piece this $2,327,000 on page 12? And is that in the 26 million that Commissioner referenced, or is that $26 million other items?
Mr. Chair, that's in the 26 million.
This 2.3 million's in the 26 million. Okay, do you have a list, Commissioner, of what's in that 26 million that you could, like, maybe just rattle off right now?
You have it? Go ahead.
Mr.
Yes,
Chair,
Mr.
Director Kelly?
it includes $9 million of cash for the Capitol Complex security upgrades, which corresponds with a bonding request for that project as well. It includes $3 million for the Department of Administration's Building Efficiency Loan Fund.
Oh, yeah, okay.
It includes the laboratory equipment for the Department of Health and the Department of Ag.
And how much are those?
The Department of Ag is a little over $1 million, and the Department of Health is $2.3 million.
Okay.
It includes just under $1 million for the lab building improvements at the Department of Health and the Department of Ag, which corresponds with a bonding request. It includes almost $2 million for a purchase of a plane for the Department of Transportation, which corresponds with the Trunk Highway Fund request, cash request as well. It includes a little over $5 million for Highway 53. And it includes the three projects that Representative Hausman referred to: Family Partnership, Tubman, and Family Tree Clinic.
All right. And can you, since that is a fairly big number, the $5 million for Highway 53, what is that?
Mr. Chair. Part of what happened during that project, there were some changes that needed to be made around the project itself, not within the actual physical confines of the trunk highway. And those costs are not allowed as part of the trunk highway fund. So the city had to engage in some additional expenditures for to prepare right-of-ways and also some utility movements, I think. So this is a reimbursement for those charges or expenses that were incurred that were not part of the trunk highway fund project itself.
And these were not anticipated ahead of time? I mean, was there some, I don't know, soil problem or something like that that came up, or what happened?
Mr. Chair, I think part of what happened was the project physically, in terms of the actual parameters of the physical trunk highway project, simply required more changes for utilities that were approaching or on the outside of that physical locality. So it wasn't anticipated that those additional funds would be needed, but they were, and they had to be made in real time because as the project was going on, they had to make some of these changes. I think most of them dealt with utility movements around the perimeter of the actual trunk highway project itself.
Okay, Representative Davids.
Thank you, Mr. Chair. And if we're going to get into a discussion on taxes down the road here, I'd save my questions till then.
Yes.
Okay.
Okay, Representative Dean.
Thanks, Mr. Chair, and to the Commissioner. Just, you had talked a little bit earlier, Representative Torkelson was asking a little bit about the use of the reinsurance, the premium security account money. And I was trying to sniff around and see if I could figure out how you're paying for the Minnesota Care buy-in, and it looks like there's $100 million, about 60 from one fund and 40 from another fund, one from the reinsurance fund and one from the premium security account, neither of which is tracked in the presentations that you have. But it looks as though you say that the 40 is coming from the reinsurance and the 60 from the premium fund. Is that correct?
Commissioner, Director Kelly.
Mr. Chair, Representative, I'm looking for the Labor and Industry, or Commerce page in this document that is on page 3 of 4, which shows the use of the Premium Security Fund. And then there is a cancellation in the MMB section showing $58 million on page 20 of 34 for the Premium Subsidy Fund.
Representative Dean.
Thank you. So that, the two together would give the 100. And was there more taken from the reinsurance fund than that? Or was that the entirety of it for the use of the budget?
Director Kelly.
Mr. Chair, Representative, the Premium Security Fund is being used for the Minnesota Care buy-in reserve.
All right.
Representative Dean.
And does the reinsurance fund go down at all as a result of your budget?
Director Kelly.
Mr. Chair, what this budget anticipates is that we will receive funding from the federal government for reinsurance, and that the state dollars that were appropriated for that purpose that correspond to the amount that the federal government will release in April of this year would no longer be needed, and that is what is being used in this budget.
Representative Dean.
So when there's, just so members know, there's two accounts that we're talking about. One is the amount of money that we put into a fund to give back to people for a 25% reduction. That's in one pot. And the second pot is a reinsurance pot. That one has 400 million that we put into it. The other one has 320. The 320 came from reserves and the 400 came from the Healthcare Access Fund. When we set that fund up, we said that if we got money back from the federal government, we would pay back the Healthcare Access Fund that money. But what I'm hearing is that we got $130.7 million from the federal government, which should be in our bank account by the first of the month, and we're spending that outside of this, and it is not going back to the Healthcare Access Fund. Is that correct?
Director Kelly.
Mr. Chair, Representative, the premium security fund, to the extent that dollars were not needed in that fund, you're correct, would cancel back to the Healthcare Access Fund at the end of 2022, and so, or 2021. And so what this budget does is it captures those dollars in advance of that and puts them into the general, in part, the reserve for the Minnesota Care buy-in, and then the general fund.
Representative Dean.
Well, I just want to alert members to that, the legislative intent of that was that if we did receive federal funds, that would revert back to the Healthcare Access Fund, and that should trigger the hold on Babalooey clause, because we should either put parameters around that or at least know that that's happening.
And I guess Representative Liebling.
Well, thank you, Mr. Chair, and I just wanted to comment on that. So this is, I'm hearing about that for the first time, but, just to remind people, the Healthcare Access Fund was set up to support Minnesota Care. Our program, just to be clear on the terminology here, because as the chair noted, the terminology in this area is just horrible. But, Minnesota Care is our program, our state public health care program for people who are just a little too wealthy for Medicaid, and yet we don't feel that they have enough money to pay regular market premiums. And this has been around for a very long time. The Healthcare Access Fund was established to support that program. So to the degree that the legislature last year took money out of that program to use for the insurance subsidies, I would say that was a use of that money that was never anticipated when the Healthcare Access Fund was established. And in fact, the legislature used a lot of other money for that fund too, just to support the regular healthcare budget. So Health and Human Services budget, I should say. So to the degree that money would be left over and would be taken out and used to support a buy-in program, an expansion of the Minnesota Care program, I would deem that an entirely appropriate use of the money, because it goes back to what that money was actually supposed to be for. Although granted, expanding it to a little bit different population, but after all, that's certainly more in line with the original intent than just taking it out to do an insurance company subsidy. So, and while I have the mic, Mr. Chair, I just wanted to suggest too that when we talk about the program that was the 25% off the premiums, I think it's more helpful to think of that as a discount program. We use this language rebate a lot, but if you think about it, what people think of as a rebate is where you pay for something, you pay the whole thing, and then you have to send in paperwork, and then you wait, and then you get something back. Whereas the way the program worked was that from the point of view of the consumer, you just got a discount off your bill and you never paid it. So I call it a discount program. I don't know if that's helpful to the chair, but I think it just kind of makes it a little easier to remember what was going on in that program.
I can remember what the program does. I just have a hard time remembering the subsidy versus the premium subsidy program versus the premium security program. And the premium subsidy program is the 25% off program. But I guess Commissioner and or Director Kelly, so let me just be clear on this. So how much money in total in this biennium are we supposed to get, or are you projecting we're going to get from the federal government here? Underneath this, that they're giving us that would be going into the premium security program?
Mr. Chair, we anticipate that the federal government will be sending $130 million this year. I am not sure if we have been confirmed, if the federal government has confirmed with us yet that amount. I'm not sure of that. But they have been behind in their confirmation and their payments to other states. So, but we are anticipating $130 million this year from the federal government. The other 42 million, the difference between the federal payment and the 172 that is being used in this budget, comes from MCHA. And that was not committed to the federal government as part of our reinsurance program. So we feel that the Department of Commerce feels that that money can be used without jeopardizing any federal agreement.
And in law, if we didn't do anything with the MCHA money, what happens to it?
Mr. Chair, I believe that it is currently in the Premium Security Fund, and any unused dollars in that fund will cancel to the Healthcare Access Fund in 2022.
Okay, and then, do you have any estimate on, well, I guess you're showing that the 130 million actually comes in 2020 from the federal government, FY 2020, is that right?
Mr. Chair, it will come in this, it's anticipated to come in this year, but this budget uses it in 2020.
Okay, do we
2021.
are we going to get more money underneath that federal program in 2020 and 2021, the out biennium?
Mr. Chair, that was a part of the, the waiver or whatever it was we received from the federal government for the reinsurance program. However, the commitment on the part of the federal government so far has only been to this year's payment.
All right, thank you. Representative Dean?
Just one more thing, Mr. Chairman, and I don't want to spend too much time on it, but it is a lot of money, and it is important because these are separate accounts. And if we don't, these would be, the intent was that the money left over in one go to the reserves and one go to the Healthcare Access Fund. And Representative Liebling, if you add those numbers together, it's more than $100 million. So the governor is using in his budget money that from that fund to fund other things within the budget, roads, bridges, whatever. But that's not health care, and it's not the intent that fund was set up for. So I think that it will be important to pay close attention to those two funds.
Representative Fabian?
Thank you, Mr. Chair. Commissioner Frans, with regards to the Minnesota Care expansion, who is eligible to buy into that Minnesota Care expansion program that the governor is proposing?
Commissioner, Director Kelly?
Mr. Chair, I would encourage you to speak with the Department of Human Services on the specifics of that program, but my understanding is it's for an income level just above the current eligibility and similar to who could buy in on MNsure, but I don't want to misspeak.
Representative Fabian?
Thank you, Mr. Chair. Well, I've read reports that it's going to be available to basically anybody. And I have real serious concerns about that. I appreciate that the individual market is in a very, very difficult place. And when I ask questions of people who know a lot more about healthcare and all this stuff than I do, which isn't very hard to do, but our critical access hospitals are absolutely vital to rural Minnesota. And when I hear about the reimbursement rates that are paid to our rural critical access hospitals, we're going to be shutting the doors on those hospitals if this goes forward. We already have hospitals that are struggling. And if someone can help me, maybe Chair Dean can help me with what the rates are. And here I just got on the Minnesota Care buy-in. It says here, anyone who purchases their health insurance on the individual market could choose Minnesota Care buy-in coverage through MNsure. Without changes in reimbursements, this is going to be another nail in the coffin for our rural hospitals. So, Mr. Chair, can I ask Representative Dean a question about reimbursement rates as they are? And I think I've asked this before. Individual market, Medicare, Medicaid, Minnesota Care. Help me out, Representative Dean.
Representative Dean?
Mr. Chair, Representative Fabian, it would be private health insurance, Medicare, Medicaid, Minnesota Care. The Minnesota Care reimbursement is about half, 50 cents on the dollar for what your hospital would get in from private health insurance.
Thank you.
Okay, members, I want to make sure we have plenty of time for the tax issue, and I know there's a little bit left here before we get to that, but Mr. Marks brought a question to me about exactly how the money is paid back to the in the premium security plan. And so I guess, I don't know, Mr. Marks, can you bring up what you found, and then I can maybe ask Budget Director Kelly just how this money is paid back? Mr. Marks.
Mr. Chair, members, just in 2017 Laws, Chapter 13, there's an order established in which the money in the premium security plan is to be spent, and it's laid out as first, any federal funding, second, any funds transferred in from MCHA, third, any funds from the Healthcare Access Fund, and then fourth, any funds from the general fund. And then the language states that if there's money remaining, money's to be transferred back to the general fund and then to the Healthcare Access Fund. So I think it's the Healthcare Access Fund may very well get money if there's money remaining, but I think the general fund is first in priority. And if I recall right, the general fund amounts were $71 million a year transferred to this account last year, and the Healthcare Access Fund amounts were $200 million a year. 71 million a year from the general fund, 200 million a year from the Healthcare Access Fund. So I think the first 72 plus 72 would go back to the general fund, and then the next 200 plus 200 would go back to the Healthcare Access Fund. So I think there's a priority order there, first of in which order the money has to be spent, and then where the money would go back to if any remained.
And members, I know this is confusing, but we are talking about a lot of money here. So I guess, Mr. Marks, I mean, are you saying that this $130.7 million that we get from the federal government, that your opinion is that 71 million of it would first go to the general fund?
Well, under the law, the money from the, strictly speaking here, the money from the federal government has to be spent first. The way the governor's budget lays it out is then it offsets that and says because the federal government put 130 in, it can go back. I believe under current law that 130 would first go to the general fund. That would almost offset the 71 plus 71 that goes in from the general fund, and then above that money would go back to the Healthcare Access Fund.
Commissioner, Director Kelly, what do you think of that?
Mr. Chair, I would say I have not seen the bill language that we are writing for this, so I don't know yet the extent to which we've anticipated whether it would be a deduction from the general fund versus the Healthcare Access Fund. I think we need to do the analysis.
Okay, but this isn't really a bill issue. I mean, this is almost a forecast issue that, I mean, if Mr. Marks is right and we're projecting that we're going to get that money this biennium, we should be showing more money in the general fund than we are showing in the forecast.
Mr. Chair,
Is that right, Mr. Marks?
Just one point on it. This, under the current law, these things would not happen until June 30th, 2021, so.
Okay, all right. Excuse me. Okay, so, but then, I guess, Director Kelly, Commissioner Frans, in the out biennium then in the budget forecast, did we show that $130.7 million going into the general fund? Is that part of the $251 million surplus for the out biennium?
Mr. Chair, no. We have not forecast cancellation of these funds.
All right. And I guess, is there a reason for that?
Mr. Chair, yes, because we don't know yet if the funds will be used or not. We forecast current law. We have not received any federal funds yet.
Okay, we haven't received the federal funds, but you're forecasting them. You're forecasting that we're going to get them, right?
Mr. Chair, we're forecasting that the full amount of the premium security fund will be used. for the premium security program is what we are currently forecasting.
Okay, Representative Fabian.
Mr. Chair, excuse me, folks, but how do you, I mean, on one hand, you're saying yes, and on the other hand, you're saying no. Okay,
Mr. Chair.
this is upsetting.
Commissioner?
This is the governor's budget proposal, so if in fact the legislature adopts this budget proposal and we change the distribution, then we will change the forecast method. The reason we don't forecast this particular proposal is because you all haven't adopted it yet. So we are proposing that we would change what is current law with this distribution.
Yeah, but I guess my question, Commissioner, though, is, I mean, leaving aside the governor's proposal in the forecast, I mean, we're saying we're expecting $130.7 million from the federal government, and we're planning on spending a certain amount of money on the premium security program. We didn't know at that time if we were going to get the $130 million or not. Now that we're getting it, it sounds like underneath the law in 2021, if we don't make any changes, that $130 million would go back into the general fund. Isn't that right?
Mr. Chair, what we are forecasting is that, like I said before, the full amount will be used for the premium security program, that is what the current law authorizes. And until the current law changes to say something less should be used for the premium security program, then we will forecast that. But right now, current law is that this full amount should be used for the premium security program. And that's what's in our program, and the governor is recommending something different.
Well, I guess I don't want to belabor this further. It seems like that's a little bit at odds with what it seems to me that Mr. Marks is reading, but I haven't really had a chance to look at all the detail in the law that he's reading. I think that we need to look into that, though, because that's a lot of money, which would really affect the out years a great deal. So I guess perhaps you can look into that and see if you have any other thoughts on it, and I'll ask Mr. Marks to look into it. But let's move on here so that we can make sure we get to the tax part of it. I guess I don't know if you had anything else on higher education, Mr. Frans, but I don't know. Why don't you get back to our sheet here and do that, and the pension and the other, and then we'll get to taxes.
Well, thank you, Mr. Chair. I think we left off with, actually, I threw in pension reform as part of our discussion, so I think we've covered the higher education, $30 million there, and the pension reform, which is $27 million this biennium and $114 million the next biennium. So I only want to mention a couple of other items, and then we can get into how the numbers add up at the bottom. One of the things that we also, this is part of the all other component, is the sexual harassment prevention. As you know, in January, MMB released a report that assessed the state of Minnesota's sexual harassment prevention policies and procedures. And that report, frankly, was a first of its kind for many states to really take on how are we doing, what are we doing to make sure that there are no sexual harassment situations, but if there are, we respond appropriately to them. One of the things that we discovered was that the investigations, the process that we could improve, that a number of people felt that we should have a centralized office that would have trained investigators that would do all of the investigations for the state and then return that investigation to the particular agency that requested the investigation. We thought this program, this office would help with consistency and really for all forms of harassment and discrimination. So that was that. That's about a $6 million request. It stands up this new office and also provides some additional training in sexual harassment prevention policies and going forward into the next year. The other,
Commissioner, do you have an estimate on how many employees will be in that office? I mean, $6 million is a chunk of money.
Mr. Chair, I don't have that in front of me. I'll get that for you, the FTE count. Part of what is involved is some one-time training development funds, too. As you know, one of the more expensive components of any sexual harassment prevention or any kind of workplace training is the development of the substantive training material. There are lots of materials out there, but most of them you have to buy or you have to develop them yourselves. So part of this is some one-time money for bringing on some new training materials, but also part of it is standing up the office. But going forward, I don't have the FTE count for what that office would be going forward. I'll get that for you.
Thank you.
I think the other thing then that I just want to mention as we work toward the bottom of the sheet that you have there is to look at the The revenue package, as you can see, is a total of $20 million net to the general fund, if you net out these three items down below. One of the things that is not included in this is the governor's proposal to what's the right way to say this, is to eliminate the sunset of the provider tax. That is, will be expiring on December 31, 2019, and Governor recommends that that not expire at that time, but that's not a general fund expense, that's all on the healthcare access fund, although in the future, if we don't extend the healthcare provider, the provider tax, we will have a general fund effect in 2021 or 2022. So we're concerned about the long-term effect of that. Now, if you look on the page in front of you for the revenue tax, the governor's 2017 tax provisions, this is the governor's, as you recall, the governor had three items that he wanted to, thought were too expensive and weren't, he wanted to have the legislature reconsider those from last session. That was the state tax provision, the cigarette tax change, and also the property tax reduction and eliminating of the inflator. That's the $15 million for this biennium that the governor's proposed, that we would go back and take and make adjustments to those three provisions. Now, the response to the federal tax bill, that is a $9 million number. That's a net number, and that is the combination of the individual side and the corporate side, netting out to a $9 million increase for 2018, 2019. There's obviously more money in 2020 and 2021. And we'll get back to those items in just a minute. So you can see that's how we get to the bottom line number of $123 million, is that we have investments of $226 million net, and we have a revenue package that's net of $20 million, and from the $329 million, that nets us $123 million on the bottom line for 18 and 19. I guess I'll leave it there because I know people have questions about the tax.
Oops, I'm not sure if technical difficulties are coming here, but I'm going to recognize Representative Davids and then Drazkowski's after one question. When I see the $20 million here as compared to the federal forecast, you're saying we're taking in $20 million more underneath the governor's plan, so we're not really quite revenue neutral. But does that include in the forecast, if I remember right, there's about an extra $60 million that's coming in from taxpayers paying more money because of their election of the federal itemization or standard deduction and so forth. Does that include that $60 million?
Mr. Chair, well, let me back up. Maybe someone doesn't want me to talk about that.
Greg, is that you? Yeah, it's the Russian.
So one of the things that happens, and this is something that Chair Davids and Chair Chamberlain obviously are going to have to deal with, and that is the complexity that comes down on the individual side. I just want to talk a little bit about that, because right now we know that if we took no action, about 300,000 Minnesotans would get a tax increase under the federal conformity. And part of that is because of the $60 million that you mentioned, the fact that your election to take the itemized deductions at the federal level requires you to do the same thing at the state level. So that's part of that problem that we inherit because we follow FTI. As some of you who have been around as long as I have know that in 1986, the federal government, we had the Tax Reform Act in 1986, and in 1987, Minnesota went to the FTI, federal taxable income, and it made a lot of sense. I mean, the tax form in those years was really pretty short, and we made that change, and we followed federal taxable income ever since. We're one of 6 states now that do that, and that's part of the difficulty is trying to follow federal taxable income now. So if we took no action, 300,000 Minnesotans would get a tax increase of about $200 per person. Now, if we decided just to completely conform to what the federal government did, then over 870,000 Minnesotans would get a tax increase and about $489 per person. And part of that is the complexity of what the federal government did at at the national level with the itemizations, the limit on standard deductions, or the change to standard deductions, the limit on itemized deductions, and the change, the rate system is different than ours. It really creates a problem. And that's why ultimately the governor's proposed that we disconnect from the federal taxable income system and we go to adjusted gross income. So
Sure, and I'm sure we're going to get into that, I know more with Representative Davis' question, but I guess I just wanted to understand that. So I guess, I mean, in terms of the governor's proposal and whether it's, revenue neutral or not, I see that here we actually have $20 million more coming in taxes than I guess net we're cutting, but then there's an additional $60 million beyond that because of the election that is coming into the state. So I mean, taxpayers are basically paying $80 million more in than they anticipated paying in on the previous budget. Is that correct?
Well, Mr. Chair, the 60 million was captured, additional, because of the election issue, was captured in the forecast because that's what's going to happen under current law. So if we change current law, that would no longer be, that's not part of the proposal you're saying today, because under the proposal, the governor's proposal, we would change the law and then we would eliminate that particular issue. So that $60 million cost would not come in because we would change Minnesota's tax system.
So you're saying basically Minnesotans are paying $20 million more?
No, I'm saying that, for the individuals, did you say?
In total, Minnesotans will be paying $20 million more.
Well, the overall tax system in the 20s that we would change would net $20 million in 2018, 2019.
Okay, well, I was trying to get to this idea of whether it was revenue neutral or not, and I guess to me, it doesn't sound like it is, but I'll go to Representative Davids. He knows more about this than I do. Representative Davids, the chair of the tax committee.
Well, thank you, Mr. Chairman. When the bill was first released, there were several very positive things in the bill that I saw. One was the suggestion or the proposal to go from FTI to AGI. That was a concern I had that I was hoping the governor would be there, and he is. So that's a good thing. So there's three basic good things that I could see. One was FTI to AGI, and that's a big hurdle. That's a big deal. And then full Section 179 conformity was brilliant. And of course, another brilliant issue was the author you chose to carry the bill. But in talking to folks, they will suggest that there's no tax increase on wage earners. I would suggest, and technically, I can see where that's coming from, but if we bring back the sick tax, even though that's offline, so I mean, the statement, I see where you're coming from, but that's quite a tax increase on wage earners, in my estimation, the way I look at it. And the numbers that I've come up with, it's about a $1.4 billion tax increase when you look at the entire package, if we did it in its entirety. So the sick tax goes right down. It's very, very regressive. It goes right down. Not only are they sick and down, but now we're going to tax them some more. I've always had problems with that, and of course, it's the governor signed the bill that took that away, and I applauded him for that. So the other thing, I mean, I'm a slightly above average salesperson in my private life, and I go to numbers. The numbers that are important to me are 68, 34, and 1. You've heard that a million times, 68, 34, and 1. Those are the numbers that I deal with. And for a $1.4 billion tax increase, it would take more than a slightly above average salesperson to sell that one to my caucus. And so I will just say that there are increases here, whether it be the corporate increases, that gets passed down to cost on wage earners. So, I'm excited about getting going on this. We've been working on this since December 22nd. I have been, and others have been. I know the department has been, the governor's office has been. So I think we're off to a good start. I think we've got some good things we can work with. There's a few things in my bill that I have some concerns about, but we'll start working through those. But technically, the way it's really interesting how you did this, to be able to say that it's revenue neutral. But when I add everything in, I'm at about $1.4 billion. We can discuss those numbers later. So. Mr. Chairman, I would just say we're off to the races.
Okay, Representative Drazkowski.
Thank you, Mr. Chair. Commissioner, in the 2021 biennium, what is the total tax increase that the governor's proposing?
Commissioner.
I've got to get, Mr. Chair, just a second, I've got to get to that
Sure. Okay.
page here.
Yeah, because I think, I'm interested in hearing that too, Commissioner, just because we're really only looking at the 18-19 numbers, and, we're seeing that there's a net $20 million tax increase over and beyond the $60 million tax increase that was in the budget forecast. But, of course, a lot of this really hits fully in 2021, so I think that's where we want to really see what the net numbers are. Commissioner?
Mr. Chair, Representative, I think one of the keys that there are different pieces to this in the sheets, and I hate to discuss them very much detail because of the incredible detail that Commissioner Bowerly has worked up on this. But what we've tried to do with providing the tax credit for families and individuals is to provide some tax relief. Because if we go to AGI, as Chair Davids knows, with no changes in the law, there's virtually no change, essentially no change to most taxpayers if we allow them to have exactly the same deductions and credits they've had before. But by adding in some tax credits, what we're really doing is taking a look at the federal tax bill. You may recall that the federal tax bill, which cost about $1.5 trillion over 10 years, about 92% of that was directed toward business benefits. If you actually made the tax benefit or the tax changes to the individuals permanent, it would have added another $1 trillion to that debt over the 10-year period. So you can see where the tax relief to the individuals is temporary at the federal level. 92% of that money, the $1.5 trillion, went to corporations. So the governor wanted to try to make sure that we figured out a way to provide some tax relief to middle and income Minnesotans with this new tax credit and increasing the working family credit. The numbers I'll put together, they're itemized here individually, but it's hard for me to pull out the different pieces. I can get a schedule for you that itemizes the different numbers for the tax bill in 2021.
Representative Driscollsky?
Thank you, Mr. Chair and Commissioner. Well, Commissioner, I pulled my calculator out. Well, let's just go through them. On page 27, we see that the governor wants to reinstate the automatic increase on the state general levy. So all those businesses across Minnesota, every business in Minnesota has seen some relief from last year's tax bill. So the governor would slap another $90 million in taxes in 20 and 21 upon those businesses, including the smallest businesses in our state. He would also add another $25 million by restoring the automatic tax increase on tobacco and restoring the premium cigar tax, so adding another $3 or $3.50 or whatever that is to people who happen to buy cigars. $25 million that is going to be extracted from them. The estate tax, seeing in 20 and 21, another $39 million approximately by freezing the estate tax exclusion at $2.4 million. So dead people will be forced to pay another $39 million under the governor's proposal. And then the response to the 2017 federal tax bill. The governor wants to raise taxes there in the out biennium by $270 million. And then this homestead exclusion, where apparently the governor wants to allow people who, some of them could be illegal aliens, to have a different type of taxpayer identification number. An additional $2.2 million in tax increases for Minnesotans. The data center exemption on page 29, I'm seeing that data centers are going to be squeezed at a cost of another $67 million, further limiting the ability of businesses to land and expand and grow and be successful in our state. The corporate tax reform that the governor has squeezes another $22 million out of businesses in the state. some tobacco products tax changes, another $4 million increase for people who smoke. They get to pay another $4 million in taxes under the governor's proposal. And then, Commissioner, the provider tax, an increase of $999 million in 20 and 21. As Chair Davids pointed out, the most regressive tax, along with the tobacco tax, of course, and the gas tax. And we have so many taxes, Commissioner, and many of them are regressive, but this one is very aggressive and regressive and appears to increase taxes by $1 billion. And Commissioner, my calculator said the governor in 20 and 21 wants to increase taxes by $1.518 billion on the people of Minnesota. Commissioner, is that pretty close?
Commissioner?
Mr. Chair, Representative, well, I have to go through and do the offsets to that. As we mentioned earlier on, the response to the 2017 tax bill, Minnesota tax bill, were the three items that you mentioned, the increases he wanted for the estate tax, the tobacco, and for the property tax change. So those are separated out specifically from the response to the federal tax bill. I'll have to go through the numbers. I didn't add them in the same way that you did because obviously the Department of Revenue is going to present those numbers. The key really here for the governor is to make sure that in 2018, 2019, that we started off with a net number that was very low, about $5 million for the federal tax response. And then going forward, he made no changes to any rates. There were no changes in the rates for corporations or for individuals. And but I'll get you that schedule for the offsets. But I don't have I didn't add the numbers myself. But I trust you can add the numbers.
So Mr. Chair.
Representative Driscollsky.
And thank you, Commissioner. Commissioner, am I within $100 million at $1.518 billion? Is it within $100 million, the full amount of taxes that the governor wants to extract from Minnesotans in this proposal?
Mr. Chair, Representative, I'm not sure.
Thank you, Mr. Chair and Commissioner.
Representative Hertaus, then Torkelson. Representative Hertaus.
Thank you, Mr. Chair, and Commissioner Frans. My two questions are really a clarification in nature. Does the governor's budget make any assumption about decoupling FTI and going to AGI? Is that part of the assumptions in that budget?
Commissioner.
Mr. Chair, Representative, yes, he would propose that we would go from FTI, federal taxable income, to adjusted gross income.
Representative Hertaus.
Thank you, Mr. Chair. And Mr. Frans, you also in your presentation mentioned the hundreds of thousands of individual taxpayers that would be impacted by some of the federal changes. My curiosity is, in your research from the executive branch, have you been able to identify that population? We have 4 tiers of income tax. Do you have any data you could share with us that would more closely tell us which groups are going to be most impacted by the changes?
Commissioner.
Mr. Chair, Representative, you mean the changes to the adjusted gross income methodology? I'm not sure I understand.
Hertaus.
Thank you, Mr. Chair. Well, I guess after that methodology, my question centers around our 4 tiers of individual tax rates. And if I were to look at those groups or individuals, or even if you were able to break it down into deciles, which Department of Revenue likes to do, it would be very helpful for the tax committee to be able to identify which individuals are going to be most impacted.
Or Commissioner.
Mr. Chair, Representative, I think the key analysis is that there's no change in the tax rates at all. So what would happen is the people under the AGI, the adjusted gross income process, would be able to access and use the same kinds of deductions they've used in the past to offset their income. So that distribution, as you mentioned, by deciles, that distribution wouldn't change under that system because they'd be doing exactly the same thing. What might happen is the folks who have middle or lower income would have this new tax credit, and so their taxes might go down some. But there'd be no tax rate increase on any group.
Okay, I have Representative Torkelson, Markwart, and Liebling. Representative Torkelson.
Thank you, Mr. Chair, and Commissioner Frans. Representative Drazkowski outlined a number of ways taxes were going up. What he didn't talk about is this proposed surcharge on titles, $2 per title. I don't know what we call it exactly, but it does seem like it's going to take some more money out of Minnesota taxpayers' pockets. Have you been in? What do we call this, Commissioner Frans?
Commissioner?
Mr. Chair, Representative, well, you know, the fee had been around for several years, and I forget what year it was actually removed several years ago. But I think the key for any fee system, on that registration system, is to fund that system going forward. So I think the proposal really is designed to make sure that that registration system going forward has regular funds to it from the people who use that system. So it's not unlike any other license or registration system where people have to actually make a payment for it. So it's reinstating a registration fee that was there before at a different rate.
Representative Torkelson.
Well, thank you, Mr. Cho. Commissioner Frans, as you know, the system really isn't providing what the citizens of Minnesota need and expect from it, and to ask them to pay more for something that isn't working seems a little unusual. Thank you.
Representative Markwart.
Thank you very much, Mr. Chair, and I haven't heard the word family used yet here in this discussion on taxes. And
Oh, we're one big happy family.
yes, well, very good. Well, I haven't heard it yet in this tax discussion, and I think that should be the focus. You know, the very first thing the legislature did this session, the very first thing, was provide the funding for a 45% salary increase for legislators. The very first vote we took. And the federal government provides a 40% tax cut for corporations. Minnesota families are left holding the bag. That's not right. That's not fair. And the priorities should be Minnesota families. That should be the priority. And that's not to pit families against businesses. In fact, I think the business cuts in the federal bill are going to be very beneficial to this nation. The Tax Foundation says next 10 years it's going to up GDP about 2.9%. The Joint Committee on Taxation, not quite as high, about 0.8%. And you look at Morgan and Stanley and Goldman Sachs, all say it's going to be an increase to GDP, the cuts. That's good. This isn't pitting one over the other. But let's face it, the federal tax bill set businesses as a top priority. Minnesota, we have to set families and Minnesotans as a top priority. You look at child care costs. I mean, it's not easy to make ends meet for families. Child care costs, whether or not it's a family or a center, for each child, $8,000 to $12,000 child care costs for a family. Tuition's gone up 43% in the last 10 years. Housing costs up 5.8% in the last year. People are paying more for health care. Families paying more just for fees to be able to get their kids to play a sport in a school. That's not right. And the governor's budget puts families first, as they should. And I think as a committee here and as a legislature, we should not allow that big, irresponsible federal government to increase taxes by even one dime on a single family in Minnesota. Not one. And so I do hope the governor separates the health care access fee out of the tax bill when it comes to it, because let's put that discussion something separate. I want to talk about the taxes and how it impacts families and so forth. And again, this isn't between families and businesses. I think what the federal government did, some of my colleagues won't agree, I think is going to benefit our nation and state and GDP. But families were not given the top priority in that bill, and we have to do that here in the state. And so one other thing that was brought up, putting the health care access side stuff aside, is that the total increase for 19, 20, and 21 that's listed on page 31 is about $441 million. That's the increase in revenue. But if you look back at the governor's plan, $383 million of that is one time. It's the deemed repatriation over those 3 years. And so you don't want one time continuing on. So you want to leave a little extra. And another 60 million was the deduction on foreign derived intangible income, which is initially shows up as a revenue increase, but according to the Joint Committee on Taxation, by 2023 begins to show a negative number, and over 10 years, actually a tax reduction of $64 billion. So you also wouldn't want to count that in the regular. So you add the 383 and the 60, either one time or the one that goes up and then goes down, that's 443, almost matches per dollar that increase in the revenue. And that's prudent, because if you were including that in there as ongoing, you'd really have problems in the future, and it's matching another governor's goal of a stable budget. So, and I would like to talk about later on, because we're going to have this discussion on taxes, the impact on some of the revenue raisers on the conformity on some of the taxes. But we haven't talked about the Section 179, which is going to be a huge tax benefit for farmers and small businesses that are in this bill. So I think we're going to have great discussion in taxes, but I think families should be a top priority, plain and simple. It is not easy today for families to make it. And let me add senior citizens who are going to benefit from these cuts also. In the last 9 years, the Social Security average increase has been 1.2% only. It was about 2% last year. The year before, only 0.3% increase. And I think 2016 or 2015, it was 0. So senior citizens are going to benefit from the governor's bill also. So we'll leave later, but family hadn't been mentioned yet, other than the happy family here of the Ways and Means. And I wanted to bring that perspective in. So thank you. And no, no little Johnny today.
Don't say little Johnny. He'll go on again. Okay, Representative Liebling, then David Hertaus Anderson. Representative Liebling.
Well, thank you, Mr. Chair. And, you know, I'm going back to where there was a discussion, I think Representative Fabian asked about rates in Minnesota Care. And, you know, I was going to kind of let that go, but we spent a significant amount of time here talking about the Healthcare Access Fund and kind of going to what was just mentioned here by Representative Marquardt. You know, I think we really need to think about this a little bit more broadly. The question I think that we have to deal with is, do we believe that Minnesotans should all get health care, or do we not? And so we can talk about, you know, breaking this down, like what are the rates in Minnesota Care, and if we expand Minnesota Care, will hospitals go out of business and all of that. So if we're not continuing with the funding source for Minnesota Care, in some sense, we are saying that Minnesota Care can go away. And I agree that Minnesota Care pays very low rates. I think we should do something about that, but it's not going to pay better rates if it's gone. So there's kind of the first question, and Representative Dean has had bills to get rid of Minnesota Care. So the first thing I think we have to ask is, do we want to do better for Minnesotans, or do we want to actually take away health care access that they have now? Secondly, I think it's important to point out that the Republican leadership in the House is pushing a bill that will take health care away from a lot of people who currently get Medicaid. Minnesota medical assistance is what we call it here in Minnesota. That will do very bad things to our critical access hospitals, because it will again create a lot of uncompensated care. So I think that we have to really decide as a state, do we believe that people should have health care? I really am concerned about rural access to health care, and we're not going to make it better by cutting the number of people who have health coverage. I think that's number one. I think that we also have to think about the fact, when Representative Dane answered that question, I thought he might make reference to the fact that actually we don't really know what the rates are, Representative Fabian. It's shocking that we don't, but we don't know what the rates are. And the reason for that is that the way we deliver our public health care programs, medical assistance and Minnesota Care, is that much of it is contracted out to HMOs who will not tell us how much they pay a provider. So it is considered proprietary. It's a business, private business thing, and we, the legislators, even when we try to raise a rate, we don't get to know how much is getting passed through. So that is a problem that I keep I've been explaining this every time I can because it's so mind-boggling that we, the legislators, are appropriating millions of dollars into this system, and we don't actually know how much is being paid to the providers. And I have hardly ever met a healthcare provider who likes that system. So, whether I certainly think that we need to continue with a funding stream for Minnesota Care. This legislature put millions of dollars into so-called reinsurance, which I call subsidies for insurance companies, so that they could supposedly reduce their rates. Maybe they have, but boy, a lot of people out there are not really feeling the relief from that. So we've got real problems across income sectors. I know that Republican members are very concerned too about people who make too much money to be able to get any sort of real subsidy, and yet they have such expensive insurance with such high deductibles that it's like having no insurance. We ought to be focusing on that, and when we're willing to spend money in our system, we ought to be spending it to make sure that everybody gets health care, not to make sure that insurance companies can have really good bottom lines. So that's my speech, Mr. Chair. If we're talking about extending Minnesota Care or the health care, the provider tax, and want to have a big rant about how that would raise taxes and all that, boy, let's talk about what people really are experiencing on the ground, which is they can't afford health care. Whether they have insurance or not, sometimes they can't get the health care they need. We got to make sure our hospitals are there for them when they need them, and we got to make sure the providers are there for them. That's what we should focus on. Thank you.
Representative Davids.
Well, thank you, Mr. Chairman. A couple of things here. First of all, there are studies coming out at this point that say that the reimbursement plan worked very well. It did exactly what it was supposed to do. But Representative Marquardt's comments about families not being made priorities, and they should be made priorities, I mean, that's a good thing. But I would say that when President Trump signed the bill on 12/22/17, lower income and middle income families made it like bandits. I mean, they just made boatloads of relief that they received because of that bill. So I think and that's a debate for another day in tax committee, I understand that. But they did very, very well by that bill, because you're going to have 86% of the people are not going to itemize. What does that tell you? That tells you that a lot of people are better off by what was signed into law. Now, another issue, I thank Chair Drazkowski for pointing out, going through kind of the different areas where this bill does have tax increases. I had 1.4 billion. He has a better calculator. He's at 1.15 billion in increases, and it's very, very tough to talk to the electorate when, because of the 2017 tax bill on a bipartisan effort, left us with a $329 million surplus, that you could expect Minnesotans to pay one thin dime more in taxes when we have these massive surpluses because of the 2017 bipartisan tax bill. So with that being said, that's another challenge we'll have, is to justify raising any taxes on anyone for any reason when the state is in pretty good shape with surpluses right now. But it'll be fun to have the debate in tax committee. I bet you're going to miss it, Mr. Frans, Commissioner Frans.
Yes.
Oh, we could probably bring him in. I'm sure he'd like to relive the old days.
Mr. Chair, Commissioner Bowley has much higher standards. I don't think I could make it in anymore. So.
Representative Hertaus.
Thank you, Mr. Chair, and thanks for the impassioned speech filled with numbers and data. I've consumed and digested that as well. I don't know that we necessarily come up with the same conclusions. I was prepared to offer a long rebuttal speech, but I won't do that. But I do want to say that we have to start somewhere in terms of growing this economy, not only in Minnesota, but nationally. And we have to incentivize work, and we have to incentivize investment. And when we do those things, that's better for everybody, and will help our budgets at the state level as well. Thank you, Mr. Chair.
Representative Anderson.
Oh, thank you, Mr. Chair. And just responding to some of my colleagues across the way, I think, when we look at what the governor is proposing is we're not actually seeing a proposal that is helpful to families. Under this proposal, you've got Minnesota families are going to be paying $1 billion more in medical costs for the elimination of the sick tax and expanding that into perpetuity. We've got the MNLARS fee that people are going to pay for something that is no fault of their own. You also just have the overall regressivity of the tax proposals that the governor has in his budget so far. And as we have learned in the tax committee in multiple times over many different chairs, anytime that you're increasing those taxes on the business side of things, it's the consumer that pays the bill. They either pay it through the products that they purchase, or they pay it in having to work longer hours. And that's, nothing that we've said. That's the documents that we get from the Department of Revenue and others. So, when you're looking at this, I'm concerned that this actually is going to hurt the Minnesota families that I represent, and I think that we can do better, and I know that Chair Davids will do an excellent job in kind of working through these issues.
Well, Representative Marquardt, I know you had raised your hand, but I hesitate to recognize you because I do want to ask if anyone's got any other questions for the Commissioner or Budget Director Kelly on the budget here, because we've kind of devolved into the tax committee here, with all respect to our tax chair.
Say his name, Mr. Chair.
But if you said his name, yeah, go ahead, Representative Marquardt. All right. We'll pretend we're the tax committee a little longer.
Well, thank you very much, Mr. Chair. According to the Joint Committee on Taxation, and we've got to use some numbers here, that by 2021, those who are under $30,000 in income will actually see an increase net, the statistics show. And by 2025, those at $40,000 or less income will see a net increase in taxes. And by 2025, 82% of all the benefits will go to $100,000 or more income. And one last thing, in Minnesota, in 2019, the bottom 60%, that's about 76,000 and under, will get about 16% of the benefits, where the top 20% will get about 68%. So it was not a huge windfall for low and middle income folks, especially in the long run. And remember, those are all temporary that go to the individuals. They end in 2025.
Representative Erdahl.
Thank you, Mr. Chairman, and Representative Marquardt. Of course, you are saying if no changes are made. I think a lot of this was passed into law with the expectation that in the future this would be adjusted and that these taxes are not going to increase on these people.
Well, I'm going to go back to appropriations, and then we'll wrap up. I guess I do want to, before I ask my last question, just remind people we are coming back here after session. We will be in this room. We will meet immediately after session. I'll make a reminder announcement on the floor. We have the overview from the Housing Department. We also have 5, I think, fairly non-controversial bills to do. So we will resume in this room right after session. But I guess my question is, Budget Director Kelly or Commissioner, did you ever find that other $6 million on education that we were talking about?
Mr. Chair, I did. Third time is the charm.
All right.
So, Mr. Chair, the biggest piece of which is Minnesota Housing Finance Agency, a $4 million appropriation for Homework Begins at Home. The governor included that because of the great evidence that suggests it improves student outcomes. So that's been included in the Safe Schools education line. And there's also 2 provisions at Human Services that total about $2 million for child care, child assistance, and Help Me Grow, is it education? And I got it here. Child support provisions.
All right. Okay. Well, thank you very much. Glad to get that information. Members, with that, we are in recess.